My name is Dr. Millie Lytle, and I'm the founder of NatMed Coach. At NatMed Coach, we run a virtual health club to empower women to take charge of their own chronic disease prevention and treatment. And self-care, in my eyes, is a radical act. It's a radical activity because it takes power back from the establishment that is paternalistic. For decades, we have been led to believe that we ought to give our bodies a control of our body over to our doctor so that our doctor can tell us what's wrong with us, so that our doctor can tell us how to prevent conception, so that our doctor can tell us how to conceive, so that our doctor can tell us what to take. You need to know the history of medicine in order to understand or be able to grasp the full meaning of what I'm talking about. Medicine would be drug focused, and that it would be progress and science focused, and this would be the curriculum. Doctors who were practicing holistic, natural, empowering the individual, home care, psychotherapy, self-exploration were arrested and ridiculed and deemed unworthy and unfit to help people take care of their bodies and to treat disease. And basically medicine throughout the 20th century carried on like this. The birth control pill was presented as a female liberation, something that women could use to determine for themselves when they wanted to have a baby, when they didn't want to have a baby, and they could take control of for themselves. Now, in part, that might be true, a part of it's the way you see it. But in another way, the birth control pill made it so that women lost all knowledge about when they were reproducing. Women stopped learning this innate knowledge about their cycle, started relying 100% on pills and estrogens. And as you've seen more and more over time, the birth control pill is used to treat estrogen dominant conditions, is recommended that younger and younger girls and teenagers take it. And, this reasoning for being female empowering has really worn thin. So self-care is radical because self-care involves taking this knowledge back and claiming the rights to this knowledge. Self-care in and of itself is a medical term, but it was also taken and embraced by Black women, by a women's movement and civil rights movement as part of owning oneself, which is a massive issue here in the United States and really all over the world, is who does one's body belong to? And as a physician myself, although I was reared in the naturopathic movement, I think this is a massive problem because I believe that this philosophy obstructs women's ability to think for themselves and obstructs their innate knowledge and wisdom that is there to know, and can generate a complacency and a hopelessness or an inability to communicate, because we also know on the other side of the coin is that hysterectomies are done unnecessarily on women. Now, I'm not mocking or condemning the fact that people do need medical care. However, people need more medical care when they're less aware of the natural rhythms and functions of their body. When we are exposed to the education and the knowledge that we need in order to effectively prevent disease, prevent crises from happening, understand what our physiology is saying, understanding when something is pathological, and as an extension of ourselves, understanding what our children are experiencing. Fever is a function of the body's ability to heal itself, essentially, and fend off virus and bacteria. And when we take a suppressant, some Tylenol or something that suppresses a fever, we're weakening our own ability to fight infection. And I hope that these couple of examples that I've shared shed some light onto why self-care is radical. Self-care is owning one's own physicality, owning one's own physiology, being independent, truly independent and capable of developing your own sense of choice and consciousness around your health decisions so that you can actually make informed health decisions. Because I want to empower people to make those decisions under the best circumstances, not under duress, not under fear, but understanding the pros and cons of the medical context, of your health context. And this is what we do in my virtual health club. So I hope that you will join me, and thank you so much for allowing me to be here. It's been my pleasure.